Hello, and thank you for joining us today for our free webinar, Tips and Tricks for Telemedicine Insurance Billing in Oregon, featuring Sarit Hirschkorn. My name is Jeff Bloom, Education Marketing Manager here at LASA OMS. With the current state of the acupuncture profession, the nation, and the world, we have decided to add to our webinar offerings to bring in experts in telemedicine, practice management, and insurance billing, in addition to our traditional clinical skills-based webinars. Our guest speaker today has graciously agreed to offer sessions each day for specific states so we can focus on the content and share the most relevant with our attendees. I will just go through a few housekeeping items now. We recommend view webinar in Chrome, Firefox, and Safari, as you may experience slowness in other browsers. If you're having issues with sound, try clicking the screen to allow the sound. If you experience any freezing or delays, try refreshing the page. And if that does not work, we would suggest trying to watch in another browser. Everyone who registered for this event will receive a link 5 minutes after we conclude to watch the webinar on demand. Lastly, we will be holding questions till the end. If you have a question for our guest speaker, please use the questions tab to assure that we ask it at the end. And then to communicate with any other attendees or technical difficulties, please use the chat tab. Now for our featured speaker. We are proud to introduce Sarit Hirschkorn. Sarit is co-founder and co-owner of AllAcuServices, LLC, a company specializing in insurance billing for acupuncturists, massage therapists, naturopathic doctors, chiropractors, physical therapists, and social workers. After spending nearly 2 decades working in corporate benefits outsourcing for multi-million-dollar companies such as PricewaterhouseCoopers, ACS, and Mellon Bank, Sarit now applies her deep knowledge and understanding of the insurance industry to the field of insurance billing for holistic healthcare providers. Please join me in welcoming.
Thank you, Jeffrey.
Oh my gosh. Sorry about that. 1 second. Sorry about that. I removed you instead of me.
That's okay. I'm not hiring you as my lovely assistant anymore.
I'm sorry. All right. Well, now please join me in welcoming Sarit.
Thank you. My name is Sarit Hirschkorn, and good morning, everyone, or good afternoon. We would like to focus today on telemedicine, specifically to Oregon. I am the co-founder of a company called AllAcuServices. AllAcuServices is a medical billing company. We do specialize in billing for acupuncturists, as my partner, Robert Vena, is licensed in the state of New York and New Jersey. I want to focus a little bit about terminology, the differences between telemedicine and telehealth, just so you know what the terminology means. I want to talk about what can I bill for as an acupuncturist, or what falls under telemedicine and how I can bill for it. We will talk about what codes you should be using, how to bill for it, how to price these specific services. I will also touch upon, do you need consent or you don't need consent from your patients? We'll talk a little bit about like HIPAA rules. And then lastly, we'll talk about treating patients outside of your state. So if you do have patients that have traveled to other states, are you allowed to treat those patients or not? We will also take a quick look at the different insurance companies and what they're offering. But first things first, I would like to start with some sort of terminology. So I'm going to move on to the next slide. And we'll talk about what is telehealth. So telehealth really means the use of electronic information and communication, which is used by a provider to actually deliver healthcare services to their patients, either via providing some sort of an assessment of a diagnosis, a consultation, even providing a treatment or education, care management, or self-management of the patient. That's telehealth in a nutshell. Telemedicine is a branch that falls under telehealth, and it's really the use of electronics, which is live stream video, phones, faxes, texts, email. That falls under telemedicine. and we will talk how it applies to you as an acupuncturist, specifically because we're all so used to being in the office with the patient, really being hands-on. What can I do virtually from sitting, in my own home office? So, for starters, these services have to be patient-initiated services. And so how do we get our patients to actually initiate those services? Well, we all know that this is a hard time for all of us. It's very stressful, and patients would appreciate you reaching out to the patients just to see as to how they're doing, how they're managing their day-to-day. And you can let them know when you do reach out to them that they are welcome to reach back out to you and schedule an appointment with you, an online appointment, where you can actually have a discussion with them. Telemedicine and everything that you're going to be providing is considered an evaluation. So everything they're going to be doing from home is the same as if you were in the office sitting with a patient and doing an extensive evaluation. The telemedicine codes are considered to be evaluation codes. The patients, as the law states, have to be existing patients, but you see that a lot of the things that we're going to review are very fluid, and on a day-by-day basis, things change. Insurance companies are becoming a lot more lax, a lot more sensitive to what it is that we're going through today, and are allowing more than the law offers. So the law says that it does have to be an existing patient that is already under your care, or either having an acute or chronic pain. And if you spoke to your patient by phone, and that's only if you spoke to them by phone, and it led the patient to be seen by you within the next 24 hours, you should not be charging the insurance company for telemedicine. You should be just charging for the treatment. We're going to move on to the next slide, and we're actually going to look at what are the state laws for Oregon. Does Oregon even allow us to practice telemedicine? And the state does allow acupuncturists to practice telemedicine, but it does have some conditions. So for starters, they would like to make sure that we have a synchronous two-way active system. It means that you are using video, and it has to be a live stream video where you can hear the patient and the patient can hear you. Your license has to be in good standing with the state. It does have to be medically necessary. And of course, most important, you do need to follow the law with regard to privacy and security of your patient's data and information. So you need to make sure that the systems that you are using are HIPAA compliant. Furthermore, the law states that if a plan does not offer or does not allow a provider to exercise or to see a patient, meaning that a plan does not offer acupuncture services, they do not have to offer telemedicine. So if a patient is not covered for acupuncture, and this is what we're seeing as we are verifying patients' coverage, that for the most part, they will not be able to provide telemedicine service. Okay, moving on to the next slide. So what can I do with my patient when I'm sitting here behind the video screen? So first thing is really just a discussion with your patient about their condition, how they're feeling, anything that may be causing them stress. You can do things such as meditation, any stress relief that you can offer, breathing exercises, Tai Chi, yoga, even tongue diagnosis can be done via video. I know that I myself have a really hard time while I'm home to stop eating, and social distancing from my refrigerator is hard. So any nutrition guidance would be helpful, and any way to even boost the patient's immune system is something that you can discuss with your patient. Self-acupressure. So if you want to show patients some cool points that they can use either for pain, for stress. It's something that you can provide them as well. Discussions with regard to hot and cold packs and how to use them. along with preparing for your sessions. What you'll see throughout as we get to the codes is that when you actually bill for telemedicine, we look at the time that we spent with the patient along with the time that we spent in preparing notes, decision making, and then obviously documentation. Any herbal consultation, okay, can be done as well via the live video stream. And as long as I see many of my clients actually created some sort of a chart, an ear chart for their patient, along with a small little packet of ear seeds, and sent it out to their patients. They're using it as another revenue stream to sell ear seeds to their patients, but they're also spending the time with the patients via video to put in those ear seeds and how to manipulate and how to place the ear seeds. So these are just some of the suggestions on what you can do with regard virtually from your home. Okay, let's move on to the actual codes. So I'm going to give you the codes, and we have to take these codes with a grain of salt, because what you're going to see is as we get to the different insurance companies are really trying to be lax about the codes, and they will allow you to use your regular evaluation code. But for telemedicine, we're looking at two different sets of codes. We are separating phone via digital live video stream or video. And we're seeing that we have three different categories. So if we look under the video stream, we are looking at 9941, which is between a category of 5 to 10 minutes. So it has to be a minimum of 5 minutes. We are looking at 99422, which is a category of 11 to 20 minutes. And then we're looking at anything over 21 minutes. I would say cap it at 30. But if you do end up staying with a patient on the line for longer, that is the last category that you can charge for. It's 21 minutes or over, okay? These codes can only be charged once every 7 days, and these codes are cumulative, meaning that if I speak to Jeffrey today, and I have a session with him, and we speak for 5 minutes, and then I call Jeffrey back on Monday, and I speak to Jeffrey for another 10 minutes. The total time spent with Jeffrey throughout the next 7 days, starting today, is 15 minutes. I am going to be charging for code 99422. Okay? So you got to add all the minutes throughout the week, and these are the minutes that you charge for, the total time. The date of service that you're going to put on your HIPAA form is the first date of service that I spoke to Jeffrey, which is going to be today. How do I charge for this? And before I get to how do I charge for this, I do want to talk about a place of service of what you should put on a HIPAA form. So usually we put on a HIPAA form, we put code number 11 for a place of service because we see patients in the office. However, for these types of claims, we are going to put 02. Okay, so if you are practicing telemedicine, you are going to put 02. And most insurance companies will require you to put a modifier of 95 or GT, depending on the insurance company. And again, all of this may change depending on the insurance company. And we'll talk about that the minute we get to the next slide. How do I charge for these codes? So you have to look at what you're charging for acupuncture services today. And I'm giving you a comparison with regard to the first set of needling. So if first set of needling, we charge $100, okay? Code 99421 is only worth 40% of the price of what we charge for the first set of needling. So I like rounding numbers up. I don't like putting 43. So I would charge $40 for 5 to 10 minutes of video. And then, as you can see, for 11 to 20 minutes, I would charge $86 or $80. Okay. And for the last code is 99423. Okay, I would charge about $120, and I'm giving you the ratio so you can figure out the prices based on what you are charging today for the first set of needling. Okay, similar to that, phone evaluations, same idea. Okay, 5 to 10 minutes, we're looking at 99441. Okay, 11 to 20 minutes, we're looking at 99442. And 21 minutes or over, we are looking at 99443. Okay, I put the comparison, or what we call the relative value, in with regard to one set of needling. And once again, we can figure out the pricing based on what we're charging for that one set. Okay, now realistically, let's see which insurance companies do allow us to use telemedicine. So here it is. We tried to list out some of the insurance companies, and I am not going to distribute those slides, but what I do suggest is that you take a screenshot of the slides, because what we are seeing as we're working on this awesome that Jeffrey gave me and moving from state to state and researching the different insurance companies is that every day they publish new regulations with regard to COVID-19 and what they will and will not allow. Whether they're going to waive copays or co-insurance, whether they're going to waive deductibles. Companies such as Aetna have decided to waive their copays, their co-insurance, even the deductibles, both for in and out of network. They are allowing their providers to submit both for online digital evaluations and phone conversations. Kaiser Permanente is only allowing, and you can see in-network, they are allowing their in-network providers to perform telemedicine. They're not allowing out-of-network providers to perform it, and they're not allowing they're not allowing patients to be seen, right? Obviously seen, right? But to be diagnosed via a phone conversation. Cigna, and I want to talk about Cigna in a minute. Cigna is very similar to what we were seeing in Aetna, and Cigna is allowing us to use the evaluation codes, and I have a whole slide about Cigna and to show you how to bill for Cigna specifically. And I know the slide says New York because I forgot to update it to Oregon, but these insurance companies are specifically for Oregon. Now, ASH. ASH is a third-party company that is administering many and working with many different insurance companies. ASH itself, as a company, is waiting for the different insurance companies to give them direction as to how to proceed with telemedicine. Because ASH was not reached out by Blue Cross Blue Shield or Anthem or companies such as HealthNet, as of right now, they're not allowing patients to be seen via online video. They're not allowing telemedicine at all. This may change, and we need to continue following up with ASH until ASH gets some guidance, but as of right now, it's not something that they are going to allow. Okay, let's move on to Pacific Source. Pacific Source doesn't allow us to perform telemedicine either. And what I want to do is I want to share what Pacific Source, and it's really good source, is to really go to those insurance companies' website and to check every day information that they provide about COVID-19. And under COVID-19, Jeff, I don't know if you want to, Jeffrey, if you want to share the link, just if we jump into that for a second. So I'm just going to wait for Jeffrey to share the PDF with everyone and to bring it up on the screen so we can scroll down and I can show you what it is that they actually publish, because it's very clear on what it is that they are showing on that website. So Jeffrey, if you can please share not just the link, but actually bring up the page, it would be great.
Alrighty, let me just do that right now.
Okay, awesome. Thank you.
Thank you. Let's see. Share media. No, we'll not share media. I'll do screen sharing.
And until Jeffrey is sharing this, I'm going to talk about some other insurance company. We're going to talk about Providence. They are allowing both in and out of network. They're not, we were told that they are not right now, they're not waiving the copays and the co-insurance. This may change. What I did put is, I put here a person that actually is helping us with the information. You're welcome to call them directly. Let's just scroll down a bit to the next page.
Alrighty.
And every insurance company on a daily basis publishes, just go a little more. Going right here. Perfect. Perfect. Okay. Let's stop right here. Every insurance company on a daily basis publish what they will allow and will not allow. It changes daily. And show you here, right, this specific insurance company specified which healthcare providers are allowed to provide services. Acupuncturists are not listed. Okay. If you're unsure or the rep is not giving you correct information, go on their site and just type in COVID-19 and the information will pop up on the screen. Okay. Let's go back to our slides.
Okay. And here we go. All right, okay. Perfect. I'll get off for you.
That's okay. And let's go back on our slides. If you look at Providence, as I said, right, there is a person here that a representative that was gracious enough. He's part of provider relations. I put as an extension. If you have any questions, feel free to contact him. He was very helpful. He told us what we can and cannot bill for. If you need to know how to bill for, he is out there and he definitely is going to help us out. When we spoke to MODA, the only thing the MODA allowed is in-network providers to provide video conferencing. They did not allow anything else. I want to talk about Cigna specifically, and I'm going to move on to the next slide. And then I want to talk about insurance in general and what it is that we should be doing. Because although we have all these codes change daily. And some of the insurance companies, as many of you are seeing, aren't able to handle the amount of claims that they're getting via telemedicine, or maybe not even equipped to process claims via telemedicine. Cigna specifically published on their site that their systems are not equipped to process all the claims for telemedicine. That if you do use the location code of 02, or you use the telemedicine codes, your codes may be rejected. So Cigna did ask that provider use the 99213, the 99214, so the evaluation codes, along with a GQ as a modifier. Okay, so when you do submit a claim for Cigna, use office location and then use a GQ for a modifier. And you'll see that many insurance companies are slowly moving in that direction because they may not want to deal later on with the denied claims, and maybe they may not have the staff to deal with those denied claims, and they do want to provide services to their patients. I would suggest that if you do have a patient who is interested in any type of service, any kind of telemedicine, that you call the insurance company, you verify if they have coverage, and if they do have coverage, find out if you should submit it via an E&M code, right, specifically, or use the telemedicine codes, okay? Also, don't be shy and ask about the modifiers. If you're getting your answers from the rep on the phone, ask for a supervisor. I also would tell you, highly recommend that you document the code, the call, who you spoke to, when you spoke to them. Take a call reference number. In the event that the claims got denied, they can always go and pull the call back, your conversation with the insurance company, and you can write an appeal to try to get the claims paid. With all of that said, also keep in mind that many insurance companies and many of your patients may have a plan that it is self-insured. Self-insured overwrite what the insurance company offers in general, and therefore, as I said before, I would suggest that you call the insurance companies and find out what specific coverage your patient has. I want to talk about, just in general, if your patient is not within the same state that you are at. Some states have allowed practitioners to provide services across state lines. Oregon is one of these states. If your patient is now in California, in Seattle, in Florida, anywhere but Oregon, you are not able to provide services. Something else that we are seeing is that although the law, when we read the law about telemedicine, it does state that it needs to be an existing patient. However, Cigna now opened it both to existing patient and to new patients. So Cigna, companies like Highmark, Blue Cross, Blue Shield, actually in the state of Pennsylvania, also are allowing it for new patients. So if you are interested, again, go on their website and check as they're updating it on a daily basis. Again, we want to make sure that when you are practicing telemedicine, you are using HIPAA compliant systems. A lot of the EHR programs, such as Jane and any other system, will make sure that your system is HIPAA compliant. You don't want to compromise your patient data. What I did do on the next slide is actually found some companies that are offering either a free trial for the next 30 days or a certain amount of sessions that are free that you may be able to use. Some of them may have a really cheap monthly fee, so into that. Now, keep in mind that telemedicine is offered by insurance companies, and maybe that is the way of the future. However, as of right now, and I'm going to go back, as of right now, insurance companies are offering it, and they do have an end date. So companies such as Aetna, saying that they are offering telemedicine, but it's going to end around June 3rd. If you can look at Moda is also offering it, and they're offering it until June 6th, and they are publishing on their site that to continue checking their site because that date may be extended depending on where we are in June. Also, some of them are waiving or lifting the timely filing restrictions that you may have with each plan. So it's something for you to review and take a look at as well. I am going to open this now for questions. And if anybody needs to review again the codes or how to bill for these codes in terms of pricing, I'll be happy to do it again. So I'm going to give it back to Jeffrey.
All right. Well, thank you so much.
Of course.
No surprise, we actually do have a good amount of questions here. And feel free to keep asking them. Do you have a hard stop time today?
Yes.
So 1 o'clock again?
Yes.
All right, so we'll try to get through these as quickly as possible. So first question for Blue Cross Blue Shield and HIPAA plans that require a pre-authorization for acupuncture. Do we need to still get pre-auths even though we will not be billing for acupuncture codes? These pre-auth units are not tied to E&M codes, so we can skip the can we skip the pre-auth process?
So I don't want to say yes, you need a pre-auth, no, you don't need a pre-auth, right? You need to call your insurance company, and they may have different rules for different plans. Again, if it's a self-funded plan, the self-funded are really administered by the company who's providing those insurance. For example, if I work for Amazon, Amazon buys insurance for their employees. Amazon actually regulates the rules of what they will and will not allow. They just hire companies like Moda and Aetna and Cigna to actually pay those claims. And so you need to find if the plan is self-funded or fully insured. Fully insured are companies that are actually running by the state. So the best suggestion is call the insurance company and ask them if the pre-authorization, are they waiving the deductibles? Are they waiving the co-pays? Are they waiving the co-insurance? Ask all these questions on the phone. And then always ask for a link for their portal so you can keep on following up as to what's allowed and what's not allowed.
Alrighty. Next question is about audio phone only. So right now in Oregon, many do not have internet capability. Would phone be acceptable?
So again, it depends on the patient's plan, right? Well, look, insurance companies right now, and it's published right here, right? Kaiser is not allowing you phones. If you want to call Kaiser with one of your patients and ask specifically with regard to phone, I saw that somebody said that we may be able, we can research it again. What we called yesterday, we were told us we were not allowed. If we can use E&M codes, you can ask again and see if they'll allow you to use the E&M codes of the 99212, the 99213 via phone conversation.
Alrighty. And the next question. Does the time calculated for telemed visit include any pre-service time, for example, reviewing medical history or post-care time?
Yes, absolutely. It all counts your time. So if I am going to have a session with Jeffrey, the first thing that I'm going to do is, okay, let me quickly look at the notes for my last treatment so I can discuss that with Jeffrey on the call. The documentation after I'm done with Jeffrey's session also takes time. You add all these minutes together, and I'm going to go back, right? So you add all these minutes together. You add all these minutes together, and then that's how you determine which code you're going to be charging for.
All right. And the next question is actually for us, and I'm going to answer it just so everyone can hear. So the next question was, will we be doing a telemedicine webinar for Maryland? That is happening on Friday, April 17th. We have a blog post that's up that's going to list all of the currently scheduled states, and I'll be updating that later today with the next 5 that we're doing. Sarit has been very gracious to do many more of these. So for people looking for Washington, we're going to do that Monday of next week, and I'll list all of the states out later today.
And then Jeffrey, if anybody has a specific insurance company that they would like us to look with regard to their state, that you can just send it to you, and we have our team preparing them what you can and cannot do, because we do need to do some research. We do have clients that are nationwide, and we provide services nationwide, but we are calling insurance companies specifically if clients are asking us. So if there's something that somebody wants us to specifically look into, just have them send you the questions.
Perfect. Thank you very much. Next question's from Cindy. What code is billed for email or text visits? Is that a unique RVU different from the others, i.e. digital or phone?
So it's the same as your digital evaluation. It does fall under these codes. The digital evaluation, the 99421, the 99422, and the 99423, and just try to add it into your minutes on how long you spent with text and emails, etc. But I would suggest that if your email is not HIPAA compliant, to try to really refrain from emails or passing data via email or even texting. The best is to really use one of the systems that is HIPAA compliant with discussions with your patient.
Alrighty. Next one. Do you have any links to the insurance company's in-house white papers regarding allowing LACs to provide telehealth services? They usually have the evidence-based false CPT circulating, but I have not checked for a long time.
So what are we looking for? The links?
It says links to insurance companies' in-house white papers regarding allowing LACs to provide telehealth services.
So they don't specify specifically LACs. Some of the insurance companies that we looked at before specifically listed certain providers, and they didn't list LACs. Other insurance companies such as Cigna, they don't list out the providers that are allowed. They're just allowing telemedicine without listing the providers. And And what they're telling us also on the phone, that if the patient has coverage, that they are allowed to perform telemedicine services. So I don't know if I answered the question. I don't have links for every insurance company.
All right. Well, Zachary, if that did not answer your question, please clarify in the question tab. Next question. I believe PackSource OHP Medicaid is allowing LACs to bill telehealth. Do you know anything about that?
I know the Medicaid does allow you. I don't know specifically with that insurance company. It's something that we are going to research. And if they're probably allowing it, it will only be in network. Medicaid does not allow any other out-of-network providers. So.
All right. So if they're in network. And then question, Cigna is billed to ASH. So does it follow ASH rules or Cigna rules?
So because Cigna is billed to ASH in the state of Oregon, it follows ASH rules because, as I said before, ASH administers many of the insurance plans. They do not administer Cigna on the East Coast. They do administer it on the West Coast. And if they are doing it for ASH, ASH right now does not allow you to bill for telemedicine.
All righty, moving on. Do you have any info on OHP/Care Oregon? Also, if you can review the percent of billing fees for the telemed codes, was it 40, 80, 100% of regular price of 97810?
Yes. So I'll start with the codes first because I want to make sure that it's clear. This is just for you to come up with some sort of a formula, come up with the pricing that you are going to charge, right? So if you charge $50 for the first set of needling, how do I figure out the prices for these particular codes? Well, take 40% of $50, right? And come up with the pricing for that 5 to 10 minutes. Take 80% of the $50, right? Which is $40. You're going to be charging $99422, right? And you can see that in reality, when you compare 99423, actually from the insurance perspective, is worth more than a first set of needling. It's worth 1.39 as opposed to 1.05. So I would just add $10, $20 on top of what I charge for my first set of needling, and that's what I would charge. So as to the other insurance company, I do not have any information, and we will need to do some research.
Okay. Next question, do you have any information on if workers' comp, SAIF, will accept telemedicine codes?
So we don't. No one asked us the information with regard to workers' comp. We can't find out. If you want to find out, the best is to call the adjusters. Adjusters either email you or call you. What we're seeing with some of our patients is that our workers' comp patients, if you are mailing claims today, they will provide you with fax. They've been really generous with just understanding where we are today, and they're providing us with faxes to send in claims. As to providing it while the patient is not there, it's something that we're going to need to research, but I'm sure each insurance company may have a different answer. And that is true to any personal injury, veterans. Veterans Tri-West is actually what we still are allowing to provide telehealth medicine, and it does take away from the number of visits that you have. So if you have a visit limitation from Tri-West, it does count as if the patient had another visit.
Well, that answers the next question, because they asked if the annual visit limit for acupuncture use for those visits of telemedicine, even if they're not billing acupuncture codes.
So that's not true for all insurance companies. That is true for Tri-West. So Tri-West is the veterans, right? And veterans usually give you an authorization with allowing to treat the patient along with a start date, an end date, a number of visits, and what you specifically can bill the patient. I would only bill for the diagnosis that you got the authorization for, and that does take away from the visit limits that you get on that packet that comes from the VA. As regular commercial insurance, we're told that it doesn't take away from your visit limit because it does count against an E&M code or an evaluation code. So that's what we are told, but best thing to do is call them and find out, as the plans varies per patient.
Somebody did ask specifically about Washington, and Tri-West and Blue Cross Blue Shield. Do they follow similar
Yes.
Similar rules?
Everybody follows similar rules. So TriWest is TriWest, right? For the veterans, they come in with their guidelines, and that's what we are told. So.
Alrighty, and next question is also about TriWest. Veterans reimbursement uses TriWest. My contact at the VA yesterday said telemedicine is not allowed, but she admitted that they don't have the most up-to-date info.
So when we spoke to them, they did tell us that their guidelines are getting updated daily, that we should charge for it, that they are allowing it as another visit. But again, right, this information is rapidly changing on a day-by-day basis, and you do have to be patient with these reps because they're learning just like we're learning. So just call them again and ask them if maybe you should be using an E&M code versus those telemedicine codes.
Alrighty, and then looks like Zachary provide a link to CPT codes for CPTs for various states, but it can be different or difficult to find one state's white versus for a specific CPT. So I'll send you that link so you can take a look at it, and maybe we can follow up on that afterwards.
Of course.
Let's see, and then Pamela said a screenshot I can take for determining the charges, the 40, 80, 100 strategy.
Yeah, take the screenshots.
Yeah, so actually,
go for it.
Pamela, we're on the page. Just the thing that you wanted to warn people is that this information is rapidly changing. So just any screenshots you take today possibly might not be relevant, tomorrow or next week. Is that correct?
That is correct.
Okay. And then next question: Oregon Health Authority issued COVID-19 guidance for telemed. In part, they state established patient limitations should be lifted to allow new patients. This may apply to only OHP or Care Oregon. I'm not sure. Do you know of this guideline and who it applies to? So
again, right, the state of Oregon may publish guidelines, but because the insurance companies are privately owned, they can either adopt the guidelines or not adopt the guidelines. So you will need to call the insurance company and find out if they adopted those guidelines or not.
All right. And now just since there's no more questions in the questions tab, I'm just looking through the chat really quick. Do you know if PIP claims are allowing telemedicine appointments with the LACs? So again, personal injury claims may differ by different insurance companies. You will need to call the adjuster and find out, A, are you allowed to perform telemedicine? And if so, should you use the telemedicine codes that we are now sharing on the screen, or should you use the evaluation codes? Because maybe the system cannot handle these new telemedicine codes. So they could be, but again, it depends on the insurance company that you are dealing with. All righty. And then just a comment, looks like Cindy said an email went out yesterday for veterans care programs with updates on telehealth billing. So sounds like if people are in network, they'll probably have gotten an email about it. And maybe if Cindy can share that link with you, Jeffrey, so we can publish it out there, it would be great. Oh, that would be great, Cindy, if you don't mind putting that in the chat for everybody, if you have it. And then otherwise, it looks like, let's see, maybe one more question here. Let's see, if treating symptoms of virus with herbs and nutrition, what DX codes do we use? So Jeffrey, I'll send you the diagnosis codes later. I don't know them off the top of my head, but there are diagnosis codes that are specifically for COVID-19 that were published. There are new codes that the systems actually are just got added. So just sure that your EHR system has it in there. I know that the system that we use, they actually published it and told us that they added them on, but I will send it to you. Okay. And then we'll email that out to the group. Yep. So it looks like we have answered all of the questions. I want to thank you again for your time today. I want to thank everyone for attending today. So we will have more states that we'll be doing in the next couple of weeks. So if you also practice in Washington, we're doing Washington on Monday, the 13th of April, and we'll have more states coming out after that. I hope everyone has a great day. And Sarit, I will see you tomorrow. And I hope you enjoy the rest of your day. Oh, I'm sorry. Sorry,
Jeffrey, Monday. I know you will miss me, but no.
I'll see you on Monday. All right. Well, have a great weekend to you, and have a great weekend, everybody.
Thank you.
Thank you.